Now, the gentleman from Vermont.
Thank you, Mr. Chairman. This is a very long bill that has one simple goal, and it is access to affordable health care for every single American. And it embraces the proposition that every American should have access to health care, that every American has the personal responsibility to help pay for health care, and that no American should lose his or her health care if they lose their job. And it works towards that goal in three different ways. First, insurance reform. And with all the discussion about the public plan, which would have to compete on a level playing field with private insurance, the major reforms are in the insurance market. All insurance companies that are going to provide and sell health care to our citizens are going to have to play fair. They're going to have to provide a level of benefits, preventive care without huge out-of-pocket expenses that drive people away from the doctor when they need to go, drive them into bankruptcy when they shouldn't be there. It will prohibit insurance company from denying you coverage because of a pre-existing condition. It will guarantee that you can continue with your insurance even if you get sick. These reforms are overdue and extremely necessary. They're potent and they will be effective. Secondly, this bill begins the process of imposing cost control, bringing about cost control into the delivery system. We cannot have a health care system for Americans that rises in expense 2 times, 3 times the rate of inflation, the rate of profit, the rate of wages. And no matter how we pay for a health care system with costs that are unconstrained, it will bankrupt itself. And what we are doing, and Mr. Chairman, I thank you for assisting all of us here on including in this legislation reforms like accountable care organizations, medical homes, and other steps that are essential to change the payment system and reward value rather than volume. We are beginning in this bill to make a major reform in how we deliver care so we can get better outcomes at lower price. And then third, this bill makes good on a promise and a goal of all Americans, Republicans and Democrats, and that is that everyone have access to health care. Fully 37 million of the 47 million Americans who now have no coverage will have insurance. They'll be able to see a doctor of their choice. Many of my Republican friends have decided they're not going to vote for this bill. But my request to them, make your decision, but help us make a better bill. If you have good amendments, this committee will entertain them, and we can make the best bill for the American people that we ultimately get that chance to vote yes or no on. When the #1 reason for personal bankruptcies in this country is health care debt, it's time for reform. When good American jobs are being shipped overseas because the spiraling cost of health care cripples our competitiveness, it's clearly time for reform. And when the first gift that a graduate from college receives is to join the ranks of the uninsured, it's time for reform. Thank you, Mr. Chairman. I yield back my time.
Thank you very much, Mr. Welch.